Happy Friday, everyone. We are so glad you are joining us today, and we hope you find this webinar very informational. Today's webinar is preparing the transition to APMs through MVPs. Before we begin, I have a few little housekeeping items to discuss. The first is our legal disclaimer. The information contained in this presentation is for general information purposes only and does not attempt to provide medical, mental health, or any other type of healthcare service. This presentation is not intended to be an alternative to medical treatment, and the content of the webinar may not, may not apply directly to specific circumstances. The information is provided by UK Healthcare's Kentucky Regional Extension Center, and while we endeavor to keep the information up to date and correct, we make no representations or warranties of any kind, express or implied, about the completeness, the accuracy, the reliability, and the suitability with respect to content. And also, if you have any questions, as always, about today's webinar, please reach out to the Kentucky REC. We are so happy to help. And at the end of today's presentation, we will be sending out a recording of the webinar to the attendees, but it may take a week or two, but we will definitely get that out to you. Here at the Kentucky REC, we offer a variety of services to help meet both your outpatient and inpatient needs. And this is the list of our services. We have service lines that we provide, and as always, if you have any questions about any of our services, please reach out. We will be happy to answer any of the questions that you may have about any of our service lines. We're always happy to talk about our service lines. Today's presenters are myself, Vicki Harden. I am a Quality Improvement Advisor for the Kentucky Regional Extension Center. And I am joined today by my colleague, Jessica Ellett, who is the Lead Practice Transformation Advisor here at the REC. And we're happy to be here with you today. The agenda for today, we're gonna discuss some quality payment program track overviews. We're gonna talk about MVPs. We're going to talk about APMs and the APP, and we're going to talk about considerations for transition preparedness. All right, so we're going to talk about the Quality Payment Program Track Overview. Okay, so CMS has created this path to value. The definition of this value is the sum of the quality of care that is being provided with additional outcomes that patients may have, divided by the overall cost of care for those specific services to be able to achieve those high quality outcomes. Historically, healthcare has been a fee-for-service industry, so CMS has created a path for participants to transition from the fee-for-service industry to this value-based industry in which reimbursement of services is based on those providers' effectiveness in preventing illness and promoting health. The path begins with traditional MIPS, the Merit Incentive Payment System, which is the foundational layer of this quality payment program and focuses more on pay performance than pay for service. Then it stair steps to the newly formed MVPs, MIPS value pathways, which we will talk about in a little bit. And then it transitions on up to APMs, alternative payment models. And there is a couple of different levels of payment models that will transition you into that full value-based care, where you have full earning rewards on the line for your organization, and that is where your advanced APMs live. We have two primary tracks in the quality payment program. So first, let's look at the MIPS track. We have traditional MIPS, which most clinicians and practices in the state of Kentucky have been attesting to and submitting for since 2017, which was the first performance year in the quality payment program. Traditional MIPS has a wide variety of quality measures and improvement activities you can select to support those measures. There is a positive or negative adjustment based upon your performance. So if you score well, you will get a higher payment. If you meet threshold, you will get a neutral payment. And if you underperform, you will get some kind of negative adjustment applied to your CMS reimbursement. So CMS has received some feedback from current participants about traditional MIPS. And some of this feedback is that reporting requirements are confusing. There's too much complexity when it comes to selecting and reporting measures and activities, and that is challenging for specialists to participate. From this feedback, MIPS Value Pathways has been created as another way to participate in the MIPS track of the Quality Payment Program. So MIPS Value Pathways focuses more on a particular type of patient population or episode of care or a type of illness. You will have more of a limited, connected set of measures as well as improvement activities to choose from that are more meaningful to clinicians. MVPs will be available for reporting starting with program year of 2023 and will be optional to participate through 2026. The APM models are contractual agreements between the practice and the APM, and there are various levels of engagement. And we will go in further specifics a little later into the presentation. All right, so all four categories, quality, improvement activities, promoting interoperability, and cost, apply to all tracks of the quality payment program. However, it might look and feel differently depending on the track you're a participant of. Traditional MIPS and MVPs are evaluated on all four categories, whereas APMs are evaluated on 3 of the 4 categories. So for the quality category, all programs will require some type of submission. If you are in the MIPS track, you will need to submit your quality measures directly to CMS during attestation. And if you participate in an APM, you will submit your quality data through your APP, which is APM Performance Pathways. A lot of acronyms to remember. For cost in the MIPS track, you do not need to submit anything for cost, but you will be scored based on your Medicare Part B claims. And if you're participating in an APM or a MIPS APM, you would not be scored on cost because cost is part of your contractual agreement you entered into as an alternative payment model. For promoting interoperability, both MIPS and APM participants will need to submit for PI. However, these are special status reweights available for this category for both tracks. So if you qualify for a special status, you may not need to submit to PI regardless of the track you are on. For improvement activities, whether or not you participate in MIPS or if you're a part of an APM, you will be scored on improvement activities. For both tracks, you can earn up to 40 points. But if you are part of an APM, depending on the type of APM you are in, you could automatically receive full or partial credit for this category. Okay, so how can the REC help you? We understand that navigating the quality payment program is not your primary job at your practice, okay? So when we partner with you at the Regional Extension Center, we help you check eligibility. We help you stay on top of that so you can understand which track you're going to be reporting in, whether it be MIPS or the newly formed MIPS Value Pathways. And we also help support your reporting requirements for your APM. We also review every 6 months over 2,000 pages of legislative rule and proposed rule from CMS related to the quality payment program. We summarize the legislation for you and we present webinars. Some of the webinars are open to the public, but we do not present certain webinars. We do present certain webinars specifically to our clients only. We also prepare impact analysis for our clients so they have a detailed document to take to leadership to assist with strategic planning and then what is predicted in the future and how they can meet that challenge ahead. We also keep you up to date on special impacts that happen, whether it's COVID-19 or some of those extreme and uncontrollable circumstances that come our way, or any CQM adjustments that can occur throughout the year. Additionally, we work with our clients with performance feedback on interpreting and understanding your feedback reports. that you receive after the performance period is over, and we help you through the targeted review process. If there has been any issues that have been identified, we can help you through that also. All right, so we're going to talk a little bit about MVPs. Okay, so we've talked about the path to MIPS value pathways. It started with feedback from clinicians to CMS regarding the structure of MIPS. So because of the feedback, CMS's goal beginning 2023 is to move away from such broad range of activities and measures and move towards an aligned set of measure options more relevant to a clinician's scope of practice. So in 2021, CMS formed and finalized 7 MIPS value pathways for practices that will go into effect for the 2023 performance year. And this past July, CMS proposed 5 additional MVPs for the 2023 performance year. We will find out if the 5 proposed MVPs that you're looking at in green will be approved and finalized in the upcoming release of the final rule, which is coming very, very soon. This list shows that the list shows that MVPs are available for a variety of specialties as well as primary care and emergency medicine. So here we see 4 categories with corresponding weights for traditional MIPS, very similar to the slide we viewed previously. The weights remain the same for MVPs and traditional MIPS. Any special statuses or scoring flexibilities you earn in traditional MIPS for a category will carry over to your MVP. Small practices and APM entity weights will align with traditional MIPS as well. Even though the category and weights are the same as traditional MIPS, it will feel a little different because they are made up of more aligned subsets of measures and activities. Quality and improvement categories have a menu of measures and activities that are relevant to the MVP. Each MVP has a list of quality measures to choose from, and the participant will select the 4 measures that best suit their practice. Their patient, it also will suit their practice, their patient population, and their reporting method. For improvement activities, the MVP will have a list of relevant activities for the participant to choose from, and then you would select the best activity for your practice. When you participate in an MVP, you receive double points in improvement activities. So medium weighted activities are weighted at 20 points and high weighted activities are weighted at 40 points. Cost is going to align with traditional MIPS as well. It's claims based, so you would not submit anything for this category, and each MVP will have cost measures that are relevant to that MVP. Population health measures and promoting interoperability are foundational across all MVPs. Population health measures are selected at the time of MVP registration, and PI measures are the same as in traditional MIPS. Okay, so there are several different options for reporting MVPs similar to traditional MIPS. Participating eligible clinicians or eligible groups can elect to participate in a variety of ways starting next year. Some of these ways are individual reporting, multi-specialty, and single specialty group reporting, and APM entity reporting all have a foundation in traditional MIPS. New to MIPS is subgroup reporting. It's an option where a portion of a 10 may elect to submit to an MVP, while the rest of the 10 elects to submit through traditional MIPS. The registration timeline, you have between April the 1st and November the 30th for the 2023 performance year to register. You can make changes to your registration through November the 30th unless, important note, unless you are electing to submit a CAPS for MIPS quality measure. that registration will need to be completed by June the 30th. And you are locked into reporting that measure for that performance year if you register for that measure. So, as a note, for fiscal year of 2023, CMS is providing no fault scoring in that a 10 or MPI or combo may submit an MVP and submit traditional MIPS. CMS will take the higher of the two scores for that final determination. So now we're going to talk about the implementation timeline for MVPs. So 2023 will be the first year you can voluntarily participate in an MVP or a report as a subgroup. Okay. Then when we move to 2024, it will be the anticipated year for voluntary subgroup reporting. So 2025 will be the actual first year for mandatory subgroup reporting. For 2027, it is the anticipated year to be the final year for traditional MIPS, making 2028 the year we anticipate MVPs and APMs will become the only available pathways. So as we move through the timeline, more MVPs will become available. So the list we looked at earlier will grow to include more MVPs and encompass more specialties. So if you are a client, we will keep you up to date on the timeline and make sure you are aware of any changes that may occur. Okay, so how can the REC help you? With so many options, how do you choose the best pathway? Okay, so the REC's mission is to help practices like yours navigate these programs and find the best path forward. When it comes to participation complexity, we help you understand how to use quality improvement tools to drive change. Some examples of that is utilizing PDSAs, Plan, Do, Study, Act. This process helps make changes easier to implement and lead to greater sustainability of the change. Data validation, drilling down into the denominator and the numerator to ensure the accuracy of your data. And most importantly, monitoring the performance for improvements and having conversations with your staff about quality improvement involving them in the changes. That's really key to the change process. There will be a mandatory migration to MVPs or APMs. We will work with you to create different strategies when testing MVP participation. We do a lot of education around APMs and overall readiness and requirements for APMs. Once you are in an APM, we can help support data requirements and quality monitoring. And also, the quality payment program is increasing penalty avoidance thresholds, which are making it more difficult to avoid penalties and earn a higher score. The REC can help you streamline performance across all categories, fully maximize additional flexibilities and opportunities within each category to make the most out of your score. We use gap analyses and we try to figure out the best pathway for you to get the most points, have the highest score, and have the most earning potential. So now I'm going to hand it off to my colleague Jessica to talk about APMs and the APM performance pathway.
Thank you so much, Vicki. Well, let's start taking a little bit of a look and just doing an overview of what are alternative payment models and kind of going through a couple of the different options this afternoon. So the term alternative payment models, let's think about this maybe as that umbrella term itself. And so this is going to be a contractual agreement arrangement that you make with a payer. Around managing the costs, the care episodes around a particular patient population with or patients with a particular condition, a chronic disease, or perhaps an episodic event. And so whenever you enter into any type of an alternative payment model, you're really trying to manage not only the outcomes of that patient, but truly you're looking to create more efficiencies and to lower the overall cost of care that you're delivering by streamlining the processes and the systems that go into that care delivery. And so alternative payment models can be many different things. They can, they can be your standard accountable care organization, They can look like bundled payments, or they can be all the way up to full capitation, full risk and full reward. And you can participate in APMs at a couple different levels. You can form your own accountable care organization. If at if your health system is robust enough to be able to handle all those different aspects of the care that you're designing your ACO around, or you can choose to partner with other organizations, other tax IDs, and join a ready-made APM that's an ACO model. And so there's a couple different approaches that you can take. And within that, there are a couple different requirements. So again, that big umbrella is just all the options for alternative payment models that are out there. Some of them are through CMS and some of them are through other payers. But when you start to drill down into the quality payment program, we want to start a sort of change and look at that scope. So looking at MIPS APMs. So MIPS APMs in particular, these are CMS deemed models. It's a specific set list. There's a little over 100 MIPS APMs now that have specifically been deemed by CMS as a MIPS APM because they meet certain criteria. Certain criteria that CMS has set forth, that the standards that they have meet those coordinated care efforts, and that they are cost-efficient models to help lower the overall cost of care, but still maintain that higher delivery of care. One of the most common types of APMs we see, particularly here in the state of Kentucky, are going to be the Medicare shared savings, the tracks A through E. Those are going to have, they're going to start out with primarily just shared savings. And as you progress through the tracks, you're going to start to assume a little bit more risk. But you don't have full risk at this point with a MIPS APM. It's sort of dipping your toe in the water of APMs through the MIPS APM track. Also, with a MIPS APM, you do not quite have the full advantages of an advanced APM, and we'll talk about those here in just a minute. However, you do participate still in the MIPS program, but just through the APM performance pathway, which we'll talk about here in a few minutes. So you still have the same quality improvement activities and promoting interoperability scoring that you do through that MIPS track. It's just going to look and feel a little bit different with the weights and the types of measures that you might be reporting. Now, when we look over at advanced alternative payment models, under that umbrella of all APMs, this is an even smaller subset of alternative payment models that CMS, again, has deemed a set list of models that they feel meet the standards of what would be considered an advanced APM, meaning that they have both upside and downside risk related to their patient's cost and controlling those patient outcomes. And so with an advanced alternative payment model, you have the option of that full risk versus full reward. And this is definitely that higher functioning model for those, if you've navigated the waters, you've successfully participated in MSSP or some other type of lower risk APM, you eventually transition up into this advanced alternative payment model because you truly have to be able to manage the totality of care, or you have to be a part of an APM that is managing the totality of care for that particular event or that particular type of condition your patient is experiencing. One of the advantages of participating in an advanced alternative payment model has been a 5% lump sum bonus. So this is on top of whatever shared savings that you've contractually arranged with your APM. But this is a 5% lump sum bonus every year for those participants in that advanced alternative payment model. This actually, in 2022, is the final year for that lump sum bonus to be distributed. Starting in actually 2024. So in 2023, there's not anything in the legislation to allocate for anything for 23, but in 2024, this is going to be replaced with what they consider a scaling factor on all of your CMS claims that you process through that APM. So how do you know if you're going to be a part of an advanced alternative payment model, what track of an APM do you participate in? So how CMS deems eligibility is by determining if a practice or if an individual clinician is a qualifying participant. And so you have to meet certain thresholds. You have to meet thresholds around billing, and you have to meet thresholds around the types of patients that you have, the beneficiaries that you have processed through that APM. And so if you meet those specific thresholds, you're then able to achieve what they call QP status. And so you have to be a part of that advanced alternative payment model, and you have to meet those certain thresholds around the payments tied through the APM or the number of beneficiaries attributed to that APM. So, and that's what gets you into that advanced alternative payment models. You have to have that contractual obligation and meet those thresholds. Once you become that QP, for 2022, you get that 5% lump sum bonus, and then that's eventually going to transition over to that scaling factor that I mentioned. You're also excluded from MIPS reporting itself. That doesn't mean that you're excluded from all reporting, because with that advanced alternative payment model, you are monitoring your quality. You do have obligations, potentially around reporting, promoting interoperability. So you are still being held accountable, and you will have to submit data through your APM around your performance annually. One thing I do also want to point out is that if you are a part of an advanced alternative payment model, but perhaps you don't meet thresholds, you don't have the number of patients tied to your APM model, so that you don't meet that qualifying participant status, then you actually, even though you're part of that advanced APM, you are still required to report through MIPS as a part of the APP pathway. You actually fall into that MIPS APM track. And so both MIPS APMs and then those participants in an advanced alternative payment model who don't meet threshold need to submit some type of quality data. They also need to submit improvement activities and potentially promoting interoperability. And so they have developed, this was within the last couple of years, they developed the APM performance pathway. And so these are a specific set of measures that you have to submit annually, just similar to what we would be doing with a traditional MIPS. But you have three basic measures that are clinical quality measures around diabetes, controlling high blood pressure, and depression screening and follow-up. You also have 2 additional administrative claims measures that are a part of this particular set. And then you also have the CAPS for MIPS survey that looks at patient experience that's built into this core measure set for the APP. And you can see that there's various different weightings that look a little bit different than traditional MIPS weightings. Quality has a little bit higher weight than improvement activities or promoting interoperability. And you notice that cost is set to 0. Vicki mentioned this earlier. Whenever you enter into any type of an alternative payment model, a MIPS APM or an advanced alternative payment model, the cost component is already built into that contractual agreement. That's the whole setup and the crux of the APM that you've entered, is to be able to manage and control your cost. And so CMS doesn't want to double score you, so they automatically set the cost weighting at 0. So now that's just a little bit of a high-level overview of APMs. We can definitely get further into the weeds around each of those categories and some of the changes that CMS is proposing, especially around MSSP. There's definitely some flexibility that is happening with that program so that you can stay in that track and stay in shared savings and lower risk for a little bit longer of a window. And we expect and we anticipate some of those changes to be finalized in this upcoming final rule that we will be having some webinars on here later in the year and early in 2023. But to talk with you all about what we can do at the REC whenever you're looking at transitioning to, whether it's an MVP or whether you're looking at testing the waters in some type of an alternative payment model, we are here for you to help identify some of the strategic priorities that you have within your organization, and also to be able to try to find some alignment, because it is challenging to have all of these different type of payer reporting programs. And where do you put your energy? Where do you put your time and your manpower and your staff and your resources to really be able to maximize your payment adjustments and avoid penalties? And so we work with you, we work with your leadership to help design and identify, those strategic priorities that you have, develop aims, goals, and objectives, so that you can have better alignment across these different payer programs, so that you can be, more efficient in your quality improvement and in overall impacting your patient outcomes. So now with that, let's talk a little bit more about the importance of finding that optimization and that balance in the quality payment program, really regardless of whatever track you're on. Vicki talked about some of the different pathways that have been carved out here and what the future is going to look like, whether you're through MVPs or, here down in a few years, or whether you're, transitioning over to that alternative payment model. Regardless of whatever pathway you're going to be going into and whatever your pathway you're currently in, having strong clinical quality performance is essential. Thresholds continue to increase with this program, and it does make it more challenging to be able to avoid penalty. So doing the work and laying this foundation as early as possible is going to set you up for success 5-10 years down the road, making sure that you have the population health mindset and the programs and the availability and that technology and the nuances to be able to monitor your data and to be able to drive that change. Also, whenever you're looking at optimizing the quality of care that you provide, there's some other great downstream effects that you really have with it. You're going to improve your patient's experience. They're going to experience more solid, coordinated care. They are going to be able to feel that they have more activation and more buy-in in their care if their providers are actively working to address their concerns, are actively working to improve the overall experience. Also, with the quality payment program, there's also possibilities to really maximize the care coordination and the communication that we have with each other across, across counties, across health systems, really through maximizing your health information exchange. And the pathways within the quality payment program are really pushing us in that direction to look to ways for our EHRs and our systems and our processes to be able to have better, smoother transitions of care. So whether you're doing formal chronic care management, or you're doing, or TCM, transitional care management, or maybe you're doing a more informal approach to it. But there are different ways that you can take and utilize the work that you're doing in the quality payment program and translating that to other programs, other concepts to help ensure the success and the longevity and the health of your overall practice. Now, there's a couple things that I want us, as we're shifting gears, to really just think about. How do you prepare for that transition to MVPs and APMs? And, we've talked about, laying that foundation of success for quality and all of the different outcomes that it can impact and influence. And I think, if we want to take a look at MVPs, I think the most important thing is to really start taking a look at your organization. 2023 is the year to dip your toe in the water with this. And I will say that even though they have created this program to make it more streamlined and easier, there are a lot of parts and pieces to MVPs. And so, one of the first steps you really have to identify is what type of clinicians do you have in your practice? And, what type of service lines do you truly offer, and how interconnected they are versus how separate and individual they are. And then you need to be able to look at the types of MVPs that are available. And with CMS's goal, they're wanting to have specific types of clinicians attest to specific types of MVPs. So the all in on specific measures, those days are starting to dissipate away. So if you're a multi-specialty practice, ultimately at the end of the day, CMS is going to want you to report an MVP that aligns with each and every one of your different types of clinicians. So with that regard, I think it's important to be able to take a look at your bandwidth. What are your limitations? What are your reporting capabilities? What is that going to look and feel like for your practice? Something again to just also keep in mind is that there is a transition period from when we are going to see the sunset of traditional MIPS. And so there is a little bit of flexibility right now, especially in 2023. You can test out an MVP, but you can also do a traditional MIPS submission, as Vicki mentioned earlier. And so I want folks to kind of keep that in mind, that that's a fail safe, that if perhaps you aren't as successful in that MVP, you'll be able to use your traditional MIPS score to help buoy your performance. So it's an opportunity for us to test those waters and to see what's going to be a valuable pathway to choose and to really start to dig into in future years. Now, looking at the concepts, perhaps you've done really well in MIPS the last few years, and you think you're ready to take on that next step around Medicare shared savings or some other type of ACO, some type of payer agreement to start monitoring and tying your cost overruns into the overall care that you're providing. So the first step is really making sure whenever you're transitioning or thinking about transitioning to an APM is that you have had that successful performance, that you do have a very strong handle on your quality in particular, and that you have a mechanism in place for being able to be able to truly to monitor the quality of care, but also the cost around the care that you provide so that you have that control. So whether that's all in-house and that you can monitor both, parts A and parts B with Medicare, or that you have partners within the community that are all going to form together to be a part of an APM. And that's, you're working with your referral partners to help manage care. Next, you want to be able to take a look at just the volume of Medicare that you provide and what that's going to impact for your practice. And then you're going to want to look at and evaluate all the different types of APM models, because there are a lot and they all have very specific requirements and thresholds that you have to meet and levels that you have to achieve and attain to stay in that particular APM. So definitely it's important to do your research on what is going to be a viable APM option for you before you do sign on that dotted line. You also are going to want to, again, try to look at, dipping your toe in the water. What is something that you can start if you're wanting to get interested, if you're wanting to start getting into that world of APMs? You want to start by dipping your toe in the water. So maybe instead of going directly to an advanced alternative payment model, you start out with something in, a bundled payment. Or you start out in an MSSP track. So definitely, taking a look at what your current performance is, what your reporting capabilities are, and what your previous success has been, what your strengths and weaknesses are currently, and what you can do to mitigate those are really some of the big things that you need to really consider for either track, moving forward in the program. So something that we do here at the REC, and I know Vicki's talked about several of these things with you already, but some of the things that we do to help support you regardless of what path you're in, it's pretty universal. We're going to work with you on your data. We're going to work with you on your numerators and denominators, looking at your workflows, making sure that you are doing meaningful change and improvement with your practices. We also help you keep track of your goals and your gap to goals around your measures. We help support you and provide, customized recommendations for improvements, specific objectives that you can work on throughout the performance year to build that quality foundation. And we have several different service lines that we work with our practices on. In fact, to help do that, whether you're more of a smaller scale or even a larger scale in scope, to really build that quality, that culture of quality improvement and continuous improvement in your organization. Whenever you do partner with us, you do have a dedicated individual advisor with at the elbow support. But not only do you have that advisor, you have the whole host of REC advisors and our expertise in navigating healthcare as well to be able to draw from. So we are very much a team collaborative effort whenever it comes to helping to support you and the issues that are most important to you as well. And just one final thing too is that we also, not only do we provide that attestation support regardless of what track you're in. But we also provide audit support. Even if you're no longer a client with us, 6, 7 years down the road, and you receive an audit request for CMS, we are going to be here to help support you. So, we are there to not just support you in your quality journey while you're with us, but we also want to help make sure that we're raising the standard and helping support the care delivery that happens across the state of Kentucky. Now, something that I do want to tell you about that's an opportunity that is available for everyone. You don't have to already be a client with us to participate in this, but we have a really exciting opportunity that we are providing to folks. It's around the behavioral health community of practice. It's a webinar series that has been developed, and in recognition of some of the mental health issues and lack of resources that are in our greater community. And this is a webinar series and really truly a development of a community of practice to empower clinicians and staff to be able to help address those immediate needs of patients if perhaps you can't get them into one of the mental health specialists within your community. So it allows you to have a bucket of tools and resources in your pocket as a clinician or even as a staff member within the practice. So we do have another webinar coming up. It's on December 1st, and you can join us. You can go to our KYREC website, or you can also go to this link here to be able to sign up. It's free. These are free resources that are available to anyone throughout the state of Kentucky to help support the mental health of their patients within their practice. And then finally, I wanted to let you know about a couple additional webinars that we have down the pike. We do have 2 client-only webinars that are available in November and December, focused around attestation and a sneak peek early look at the final rule in December. And then we have another open to the public webinar that is slated for January 10th. That'll be, again, open to the public, where we will discuss some of the different highlights and considerations and changes to the quality payment program for this upcoming year. And if you have any questions, we just ask that you please give us a call. You can reach us at 859-323-3090, or you can go to our website at KentuckyREC.com, or just email us directly at kyrec@uky.edu. We are definitely happy to help answer any questions that you have around APMs, MVPs, or how we can work with you in the future to help support your practice. Again, Vicki and I want to thank you both for your time and attention today, and I hope you all have a lovely rest of your day. Thank you so much.